I am about to re-record chapter 3 for the third time. Hopefully this one will work. I had to click a little button. So we're going to re-record chapter 3 as we talk about neurobiology and pharmacology. We talked about Eleanor. I mentioned Eleanor many times, so I kind of remember her. So she came in presented with problems, complaining of having a problem sleeping. Also, so her friend brought her in, so she started speaking very slowly, uh, thinking before she answered any questions. So she was a professor, science professor. So she came in complaining of just wanting something to sleep. As we talk about Eleanor, we have to look at maybe what's causing it. So the problem with sleeping and not having problem remembering. So we look at the function and the activity of the brain, in which we stated that the brain will help with maintain hemostasis. It regulates the autonomic nervous system and our hormones. It controls the biological drives and behaviors. It helps with our cycle of sleep and wakefulness. The circadian rhythm. Um, it helps with memory activities, memory and memory skills, social skills. I'm sorry. The composition of the brain is made of neurons, which they respond to stimuli, conduct electrical impulses. Also, they releases neurotransmitters. We're going to be talking about neurotransmitters in just a minute. Neurotransmitters basically is a chemical substance that function as a neural messenger. They release from the axon terminal at the presynaptic neurons on excitation. When the clouds get excited, then those neurons become excited. The neurotransmitter crosses over the synapses, whereas they are attached to those receptors. Uh, again, so as we talk about neurotransmitters, and we're going to be again talk about a little bit more in depth as we talk about specific ones. Function of the brain. The brain function, it regulates internal organs and vital functioning. The hypothalamus, it's a basic, it's a drive. It's links between thoughts and emotion, and also function of the, it helps with the function of the internal organ as well. And of course, our brain stem possesses, it's a processing center for sensory information. The brain stem is a processing center for sensory information. And as we talk about the brain stem, the limbic system, the LAMBIC, plays a critical role on the emotional status and physiological function using these neurotransmitters, norepinephrine, serotonin, dopamine. So these are three that the limbic system uses: norepinephrine, serotonin, and dopamine, which help with emotional status and psychosocial functioning. Function of the cerebellum, the cerebrum. The cerebellum helps regulate skeletal muscles, mimic, also help maintain equilibrium. The cerebrum helps with mental activity, regulates mental activity, conscious sense of being, emotional status, memory. It also helps control skeletal muscle movement and also language and communication. It's regulated through the cerebellum. Um, then, as we look at Eleanor, as we assess her during the interview process, she demonstrates she's speaking more slowly, difficult to answer questions slowly. Her friend takes her hand and explains that Eleanor has been having more difficulty with memory lately, both in small things like where she ate, what she ate last, or whether she ate. Bigger things like what was she uh, doing in the middle of discussing and during a classroom lecture. Okay, so as we look at this audience question here, which part of the brain is most responsible for Eleanor's difficulty with delivering her lecture and remember whether she has eaten? So of course it's going to be the cerebrum because we said it's responsible for mental activity, memory, language, and the ability to communicate, and also among other conscious tasks. And the brainstem functions like things like helping regulate the heart rate, breathing, digestion, and sleeping. And then the cerebellum, on the other hand, regulates the skeletal muscles, and it also helps with equilibrium. Then, of course, our hypothalamus is like it's the control basic. It basically controls our drive. It helps with our emotional and functional of the internal organ as well. It also works with the brain stem to regulate our cycle of sleep and wakefulness. Um, so it's again, these are how the function of the brain work. Again, some of them work together. As we look at different images or how we can visualize the brain, we look at structural imaging, which is techniques provide overall images of the brain and also the layer of the brain. Then we look at functional images, which reveals physiological activity in the brain. So you got structural and you got functional images. And some of these tests, diagnostic tests, show structural, whereas some shows functional. So we're looking at the EEG, the CT, the MRI, the fMRI, the PET scan, and the SPECT scan. So as we look at this next question, we're going to look at some of the examples. So which neuroimaging technique will reveal problem in the anatomical structure of the brain, but not problem in functioning of the brain? So of course it's going to be your CT scan because, like I said, CT scan is it's a structural imaging technique, and your MRI is a structural imaging technique, along with your fMRI, and those are not choices on here. So as we look at problem with anatomical function, we're going to be looking at structural images, which will be A. Then on the other hand, functional images going to be tests like your PET scan and your SPECT scan, which shows physiological activity in the brain. Okay, so that's the difference. So again, as we look at disturbances in our mental functions, it could be genetic in nature, or the disturbance in mental function could be related to neurotransmitters. We kind of talked about the norepinephrine, the serotonin, the dopamine. These are some other neurotransmitters: glutamate, GABA, and neuropeptides, and acetylcholine. Alteration in these chemicals in the psychiatric disorders, um, and then also there could be an alteration in these chemicals, which could be due to some psychiatric disorders, and also will put the clients at would also target the need for pharmacological treatment for these clients because of the disturbances. And as we talk about we're going to talk about the psychotic psychotropic medication, what those drugs do, the pharmacokinetics of those drugs, and the pharmacogenetics. As we look at pharmacokinetics of the drugs, we look at the absorption, the distribution, metabolism, and excretion. That's what we was talking in class the other day. It's so important. Certain drugs we have to look at whether there's a lab value or labs that's associated with that medication. So we're looking at the effects of those medications. Are they overacting or are they underacting in the body? So we're going to be looking, are they, we said the kidneys excrete, the liver breaks down. So of course, if a drug has hepatotoxicity or nephrotoxicity effects of it, we have to get our lab values, looking at kidney function, our liver functions, okay? All of our enzymes, okay? As far as agonists or antagonists, with the agonists, these medications, they mimic the effects of those neurotransmitters. So they act like those neurotransmitters that are found in the human body. So they bind to, and so they help stimulate those neurotransmitters. So like, for instance, if my dopamine level is a little low, I may need an agonist to help stimulate those neurotransmitters. Then antagonists, they block the dopamine or serotonin may be overactive. So we need drugs to block them from binding to those receptors. We need those drugs to obstruct the neurotransmitter action. So you got agonists and antagonists. So we need to look at the differences. So as we talk about medications, let's look at some anti-anxiety and hypnotic medicine. Remember in the class we talked about those benzodiazepines, and I referred you guys to go to the handout on page 13. So benzodiazepines, these are some that are used for anxiety or panic attacks. And as you notice, they're ending some PAM and LAM. So again, benzodiazepines for anxiety or panic attacks. So these benzodiazepines, they promote the activity of GABA by binding to those specific sites on the receptors. So when they bind, they increase the frequency of the those dopamines. those neurotransmitters, I'm sorry. So with gland, we're trying to increase, we're trying to stimulate. So we need these drugs to stimulate. And again, those benzodiazepines possesses anti-anxiety, hypnotic effects. So they help with sleep. So again, they also serve as a muscle relaxant as well. They have those properties. So if a client is getting a muscle relaxant or getting something to help them sleep, safety would be a big issue for these clients. Okay. Um, these are some benzodiazepines that are used for sleep or insomnia. Again, these medication, again, they are very, they could be addicting. So we need to monitor the client for addiction. Um, Pharazepam, temazepam, and triazolam. These are some of your that are used for sleep. And then chlorodiazepam peroxide, again, also known as Librium. Then these are used for alcohol withdrawal. Diazepam and lorazepam also used for those clients with going through alcohol withdrawal. Then you have your short-acting Z hypnotics. They also use for sleep. Uh, Zolpidem, uh, and then Xalapane uh, as well, and exoclone, Lonestra. Lonestra has been out for a long time as well. These short-acting sedative hypnotic sleep agents, they're non-benzodiazepine effects. They have that. They possess as hypnotic also, but they are non-diazepine. So they're not used for anti-anxiety, anticonvulsant, or muscle relaxant. They don't have that same effect as your benzodiazepine. So the FDA does have a warning on these medications because they have hypnotic effect. They can also be very dangerous, specifically that Ambien, Zolpidem, Ambien. Again, these clients they're they're to be used with caution because they could have some effects, the hypnotic effects. So again, some clients that take this that Ambien they may sleepwalk. So again, we need safety will be a big issue. They also have that risk for suicidal based on the literature. Ramelteon is another one. Ramelteon is another drug that these are some melatonin receptor agonists. Melatonin we know could be bought over the counter. Doxepin, uh, Oxyrin is another one, a melatonin receptors agonist, and buspirone is another. Buspirone acts as a partial serotonin receptor agonist receptor. Doxepin, on the other hand, it has low form doses. I mean, it's a low dose formation of your tricyclic antidepressant, and also these medications can also produce sedative effect because they have histamine in them. They're doxepin. Remeltion again is similar to um, endogenous melatonin. Um, it can be very potent. It can also promote sleep. With some parents give it to their children and their pets to help them sleep. That melatonin. Um, Also, we have drugs that treat anxiety disorder. Some of your antidepressant. And remember, I told you the other day, look at your handouts. Your means. Um, Again, we're gonna look at some of those, the MAIOs, um, and the effects of those. These are the different classifications of antidepressant SSRIs, your NRSIs. So we're gonna talk about these individually, and I kind of mentioned MAOIs uh, inhibitors. So we're going to look at those individually on our handout. And then let's look at some mood stabilizers. Lithium. Lithium um, is also, it has the anticonvulsive properties uh, as well. So these are some mood stabilizers. And we're going to talk about lithium specifically when we get over to that handout. Anticonvulsant medication. Uh, Depakote, carbamazepine, uh, lamotrigine. Uh, these are some of your anticonvulsant medication that are used as to help with mood, as a mood stabilizer. Now, I want you to pay very close attention to this right here. When we look at antipsychotic medication, we have what we call first generation and second generation. Second generation is also called atypical. Then you have your strong agonist, antagonists. They block, these are your blocking agent. I kind of talked about those early on. Dopamine, they block the attachment of dopamine. They block the transmission of dopamine. So your strong antagonists, these are blocking agents. Okay, so let's look at our first generation medication. First generation medications are used like your acetylcholine, your norepinephrine, your histamine. As you can see, the first generation has significant side effects, which is sedation and weight gain. So again, with that being said, we need to make sure we um, these clients they are going to be at risk for injury. So again, safety will be a big issue for these clients. And also with the histamine effect of the medication, these clients, like I said, could be dry, they could be become sedative. So again, we need to, a client with taking these medications, they may be non-compliant because of the weight gain. So we need to teach them that that is one of the side effects of the medication. Okay. And then let's look at, so these are used, first generation used, but we want to use the second generation first because they do have fewer of your extrapyramidal side effects, and they target both your positive and negative symptoms. So we use these as the second generation as our first line treatment over our first generation drug because again, like they have more favorable side effects. So they have lesser side effects than your first generation. So we use these, they often our first line of treatment, your second generation. Okay. These are some of the second generation, some of the drug, clozapine, risperidone, quetiapine, which is the same thing as Seroquel, olanzapine, Zupra, uh, Zipridone, um, and also Pripazole and Belify. These drugs, the second generation, again, like I said, they have that strong anti-muscarinic properties. Um, Now, these medication, I want you to remember, the second generation medication has a tendency to cause insulin resistant. So what they can do, they can lead to an increase in your blood glucose level. So you definitely want to be checking your blood glucose level on with these clients on these second generation drugs. Okay? And these are just some other examples of some second generation drugs as well. And I'm going to take you to the sheet on the ones that we need to prepare for this test. Medication for attention deficit, ADHD, or hyperactivity. Um, uh, the first one is methylphenidate. Methylphenidate, Ritalin. Ritalin has been around for a long time as well. Alderol, your amphetamine. And then remember, these are medication also. And Quanafine is another one that's been around for a long time. And clonidine. Clonidine works as it helps also with um, the blood pressure and heart rate, but it also helps those clients with, uh, with sleeping. So it causes insomnia. My mom takes clonidine, so she sleeps a lot, and we have to decrease the dose of it of that clonidine. Atomoxetine, that's amoxidine, I'm sorry, it's another one that's been out for a long time. So these are all your medications that are used for ADHD. So they have that effect. They block the reuptake of norepinephrine and dopamine. Okay. Now, cholinesterase inhibitors. These medications are used to treat those clients with Alzheimer's. These are just some of them. Rivastigmine is Lexilon. It's been around for a while. Donepezil has been around for a while as well. Glucamate blocking agents, nimetatine, um, Namenda, some of you may know about Namenda. What these cholinesterase inhibitors do, they slow down the rate of memory loss. So they slow the rate down. Those clients with Alzheimer's, they have memory loss deficit. So these medications slow the rate down. They slow down the breakdown of acetylcholine as well. So they help slow down the breakdown. They slow down the release, the amount of choline, acetylcholine that is being broken down to help with the memory. And then the last thing I want to talk about herb medication. Now, herb they may show some positive effect. However, there's some concerns that they may lack the safety and efficacy because they are not regulated by FDA. That still remains a problem. They may not show all the active ingredients displayed on the label. So again, that's a big concern with the FDA. So as we talk about herb meds, when the clients talk about their medication, we do assessment. We want to know what herb medicine you're on because they do have some interaction with regular medicine, and so we need to know they can enhance or they can inhibit or decrease the effect of a prescribed medicine. Okay, and all of you know herbs are bought over the counter, and there, like I said, there are concerns due to FDA not being able to regulate them. So this is another question. A patient has decreased circulating levels of GABA. Which health problem is most likely to we suggest here? And again, that's going to be C. Neurotransmitter GABA seems to play a critical role in those clients with anxiety. It decreased levels are associated with anxiety. So there's a decreased level of GABA, then these clients will have they're going to be at risk for anxiety or panic attacks. So the answer is C. And then the last question is Eleanor, the case study that we began with. She's treated with a blank, which helps slow down the destruction of acetylcholine. So I just told you those cholinesterase inhibitors, they slow down the rate of memory loss. They improve memory by inactivating those enzymes that break them down, that break down the acetylcholine and the cholinesterase. Which also we want to decrease the destruction of acetylcholine, okay, which will increase or improve memory loss. So hopefully this presentation has gotten recorded because I've done it 3 times. So we're going to take a look at it.